I had a patient do a real bamboozle the other day, but my super smart friend and colleague that I worked with figured it out before I did, and she was exactly right. So we had an elderly patient come in by ambulance, and the patient had fallen at home. They fell asleep at the dinner table, and the spouse put a blanket over them, and then when they fell asleep, they just zonked right over in the chair and bonked their head. Well, the patient was on a blood thinner, so we needed to do a CT to rule out an intracranial hemorrhage. We know that anytime a patient's on a blood thinner and they take a header, we need to do a CT and rule out any kind of intracranial hemorrhage. Well, the head CT was fine. The patient had several lacerations and skin tears, and so we needed to repair those. But of course, we drew labs as we do on all of our trauma patients. And when they started coming back, they were not what I expected. And then I saw the ETOH was elevated, and I thought, I did not expect that. I did not smell alcohol in the patient. They didn't tell me they had been drinking. The spouse didn't tell me the patient had been drinking. And I noticed some of the electrolytes were off. And so I said, oh, I wonder if this is alcoholic ketoacidosis. And I'm starting to look through the labs as my colleague sitting next to me started looking through, and she said, no, Gwenny, I think it's beer potomania. And I said, oh, I scrolled to the sodium, and she was so right. The patient's sodium was 119. Guys, that is a really low sodium value. We know that normal sodium is 135 to 145, and a critical sodium level, critical hyponatremia, happens at 120. And with that, we run the risk of brain swelling, right? Because we know the brain cells are so susceptible to peer pressure that if the vasculature has low sodium, the brain cells want to have low sodium, and they can't get rid of their intracellular sodium. Instead, they have to bring on intracellular volume to dilute their sodium. And so that can cause the brain to swell if every single brain cell were to bring on more water. And so that's exactly what was going on with the patient. And with beer potomania, we see this happen with heavy beer drinkers. Whereas with alcoholic ketoacidosis, we see this in like liquor drinkers. But these heavy beer drinkers bring in so much volume, and beer has such a low sodium level that it causes a dilutional hyponatremia, as well as it can injure the kidneys and impair the kidney's ability to filter out fluids and help to balance the sodium. So next time you have a heavy beer drinker, right? These are the patients throwing back 12 natty lights a day, or even just college binge drinkers that have the dilutional hyponatremia. If they're acting a little bit funny, it may be severe hyponatremia. So take a look at their labs and find out and treat appropriately.